Trinidad and Tobago is not planning to impose total lockdown on the country yet, despite reports of the fifth COVID-19 death. U.S. sanctions prevent Chinese aid from reaching Cuba. And former Marseille president Pape Diouf becomes first COVID-19 victim in Senegal. Hello and welcome to Telesur. I'm Doris Polo in Quito, and this is From the South. Trinidad and Tobago has recorded its fifth COVID-19 related death. This Wednesday morning, the Ministry of Health issued an update noting that the number of fatalities rose by 1. Now, so far, 89 people have tested positive for the virus, with 49 being citizens who recently returned from a cruise. One person has recovered. Trinidad and Tobago's Prime Minister Dr. Keith Rowley has said his government is not planning to impose a total lockdown on the country yet, but are looking for other preventative measures to contain the spread of the virus.
We have been taking steps of interventions, steps of exhortation, based on what advice we got, the nature of the problem, and based on the advice we determine what is the most appropriate state response. And that's where we're at. What I just said is that if the situation is deemed to be that we need to be more interventionist, and that intervention would put us in a better situation, then the government will have no difficulty in doing it. But last time I was here, I spoke at length about this whole question about the demand for a lockdown. And I thought I went into detail as to what that really means if we actually do that. For example, in our neighboring territory of Grenada, there's a 24-hour, 7-day curfew. Any government could do that if you wish, but it might suit that situation. Question is that what is best for us under our circumstances? When we get to that bridge, you'll be the first to know.
Now, Prime Minister Dr. Keith Rowley also defended his recent meeting with Venezuela's vice president after concerns were raised about it at the same media conference moments ago.
The meeting that I had with the vice president of Venezuela had absolutely nothing to do with the Maduro United States criminal development. Absolutely not. As a matter of fact, it didn't come up. And let me just say one more thing, because I see there are those who believe that there's something here to make Janjat over. When, as Prime Minister, I meet with the Queen of England, the Secretary General of the United Nations, the President of Ghana, or the Vice President of Venezuela, I want the people of Trinidad and Tobago to understand that it is all in the interest of the people of Trinidad and Tobago.
The Cuban ambassador to China has heavily denounced that a shipment of Chinese aid was blocked from reaching Havana due to U.S. sanctions. In a statement on the embassy's website, Cuban Ambassador Carlos Miguel Pereira described how the U.S. company hired by Chinese tycoon Jack Ma to deliver a shipment of masks and COVID-19 test kits to Cuba had backed out last minute due to U.S. regulations described in the Helms-Burton Act. Jack Ma, who is the founder of tech company Alibaba, has managed to deliver tons of medical aid to more than 50 countries, including the United States. Now, as Cuba struggles under U.S. sanctions, doctors and medical students are visiting residents living in low-income neighborhoods in the capital to ensure they have all the necessary information to tackle the COVID-19 outbreak. So far, the Caribbean country has confirmed 186 novel coronavirus cases with 6 deaths. Cuba has also sent more than 800 medical staff in 13 teams across the world to assist other nations in their fight against the deadly pandemic. Ensuring that none of their own citizens are left behind, healthcare professionals are going door to door across poorer communities in Havana to educate the local population.
There is always a period, more or less from September to October, when we do research on the subject of dengue, and when the situation became worse with the coronavirus, the university proposed we carry out the research.
We can win this battle, like so many we have won, especially with our human capital, which is what we can count on most.
Haiti has confirmed 16 novel coronavirus cases, while one person has recovered, according to the Ministry of Health. Health Minister Marie-Greta Roy-Clement has also revealed that more than 200 people are quarantined while they await test results. As a response, the government has closed the border, ports and airports, but has kept supply chains open. Officials have once again urged the public to continue to abide by all the state's health and safety standards already issued to prevent the spread of the disease in the country. Staying in the Caribbean, with 13 confirmed cases of the novel coronavirus in St. Lucia and suspicions of community spread, the Prime Minister has announced a 24-hour shutdown beginning this Wednesday.
After discussions with my cabinet colleagues and also with the relevant Ministry of Health directors, we have determined at this point that we have to expand our shutdown of the country. So as of 5 a.m. tomorrow, every person shall remain confined to their place of residence, inclusive of their personal yards. In essence, we're going to put into effect a 24-hour curfew. A person can only leave their place of residence upon written authorization by NEMO, inclusive of essential services. People are not permitted to go to the beach, go for a walk, or to visit their neighbor. People will only be allowed to leave their place of residence for medical emergencies.
Now, as we've mentioned before, Caribbean countries are implementing strict measures, including stay-at-home orders and the closure of borders to combat the COVID-19 pandemic, as the region has 2,309 cases to date. However, the Caribbean Public Health Agency has advised it is preparing for second and third waves of the virus once those measures are slackened.
Because we are aware that there will be second and third waves. And so we need to do a risk profile for those who will be affected by the second and third waves. Because if you think about it, with all of these measures that are trying to protect those persons with chronic diseases, lung conditions, persons who are older, there will be some people who will not be exposed. But if we open our borders, or we increase the traffic from countries that still have transmission, there will be then an inject of another set of disease for those persons who have not had it before. So it's going to be important that we do that, not just demographic, but epidemiological profile.
We'll take a short break now. When we come back, we'll look at a food crisis developing in Argentina as a result of the COVID-19 pandemic. Don't go anywhere. Welcome back. China has announced it has more than 1,300 asymptomatic COVID-19 cases. This is the first time China has released such data as public concern grows over people who have tested positive but are showing no symptoms. The National Health Commission said 1,367 asymptomatic patients are under medical monitoring, with 130 new cases added in the 24 hours. Experts agree that asymptomatic patients are likely to be infectious, but their infection rate is still being debated. But Chinese respiratory expert Zhong Nanshan said that asymptomatic carriers could potentially infect 3 to 3.5 people each.
From today on, we will report the relevant information of asymptomatic cases every day. For asymptomatic cases and their close contacts, we should do a good job in monitoring, tracking, isolating, treating, and doing other work to prevent the spread of the epidemic.
The number of people requiring food assistance in Argentina has risen from 8 million to 11 million since the start of the COVID-19 pandemic. The surge in demand for government assistance comes as informal workers have been left without any work due to strict quarantine measures implemented to curb the outbreak. Over the past few years, many in Argentina have been struggling to make ends meet since the previous government left the country with a 40% unemployment rate.
People who were part of the food assistance program, but who occasionally had work, they entered and left the program. But today, they require more assistance. The demand for food assistance increased from 8 million people to 11 million people.
Nationwide protests continue against Brazil's far-right president due to what many call his deplorable response to the global pandemic. For close to 2 weeks, people have been banging pots and pans out their windows and balconies across the country during the president's nightly addresses. Over the past days, Bolsonaro has quarreled with a number of state governors who implemented quarantine measures to curb the spread of the COVID-19 outbreak, prioritizing the nation's economy over its well-being of its people. The province of Guayas in Ecuador has been the worst hit by the COVID-19 pandemic in the country, with well over 1,000 confirmed cases. Locals say the government's response has been lacking, as many are dying in their homes, while authorities often take days to pick up the bodies.
The province of Guayas, in Ecuador's coast, has reported over 1,300 cases of COVID-19. On top of this, endless complaints by citizens on social media denounce a poor response from the government. For their part, authorities have tried to play down the issue by claiming that a disinformation campaign is trying to hurt the government. But the people of Guayaquil tell a different story.
The health system in Guayaquil collapsed. The phone number implemented by the government to tend to possible cases is a complete failure. Taking the COVID-19 test is expensive. People are dying on the street. We are seeing videos of this every day. Mere blocks from my house, there are bodies on the streets, waiting to be picked up by authorities.
People on the street tell similar stories, and they don't know who can help them. There's even rumors that official figures of the pandemic are being reduced significantly.
The bodies are not being tested for the virus. My brother died days ago, but we don't know if it was coronavirus, and we'll never know. He was diagnosed with dengue. He was obese and had diabetes. He was a high-risk case. We won't know the truth, and he won't be canceled. We couldn't even have a funeral for him.
Meanwhile, accusations of corruption in the purchase of emergency equipment have come to light. The agency in charge has announced those involved in the corruption will be fired, as authorities insist the government is carrying out all possible measures to contain the pandemic.
We have increased the healthcare personnel in Guayaquil to take care of these type of emergencies using the appropriate equipment. People will be treated with dignity and respect during these times that we are living.
The wave of complaints about the bodies littering the streets of Guayaquil led to President Lenín Moreno to announce the creation of a task force that will make sure the dead receive a proper burial.
Moving to Africa, Senegal has announced that the former president of the French football club Marseille, Pape Diouf, has died aged 68 after contracting coronavirus. The Senegalese president, was president between 2005 and 2009 when Marseille reached 2 French Cup finals.
Yesterday, Tuesday, March 31st, 2020, at 7:43 p.m., Senegal registered its first case of death related
innovation, science, the technological breakthrough, and its influence in society.
Viajeros del saber, el futuro está aquí.
Atomy. Monday, only on Telesur.
Welcome back. Spain has the world's second highest death toll following Italy after the COVID-19 virus claimed a record 864 lives in 24 hours, bringing the total to more than 9,000. This while confirmed cases have surpassed 100,000. We have a total of 9,053 people who have died from the novel coronavirus, with 864 new deaths in the last 24 hours. Based on reports from autonomous communities, the cumulative number of confirmed cases stand at 102,136. Of these, 5,872 patients have been admitted or are still in the ICU. This is also a cumulative figure, and in general, what we can say is that the increase in cases since yesterday is about 8%, which tells us that we are still working to stabilize the pandemic. Turkey has sent a shipment of masks, protective suits, goggles, and disinfectants to Italy and Spain to help the countries combat the new coronavirus outbreak. As a token of solidarity, Turkey also wrote the following words on the crates: "There is hope after despair, and many suns after darkness." The Bangladeshi government has extended a shutdown until April 11th to stem the spread of the novel coronavirus. Prime Minister Sheikh Hasina said the general holiday, announced on March 26th and due to end on April 4th, will be extended for 5 more days. During the period, only food, medicine, and export lorries are allowed to move. The decision came as 2 more COVID-19 cases took the country's tally to 51 on Tuesday, with 5 deaths reported so far. Georgia has imposed a general quarantine and a nighttime curfew to fight the coronavirus pandemic. Prime Minister Georgi Gakharia said that the dynamics of the growth in new cases of the COVID-19 is alarming. The curfew will apply from 9 p.m. to 6 a.m. Georgia has a population of 3.7 million with 115 confirmed cases of COVID-19 as of Wednesday. There were no fatalities. U.S. President Donald Trump has accepted the help offered by Russian President Vladimir Putin to respond to the coronavirus pandemic. A spokesman for the Kremlin announced on Tuesday that Russia will send a plane with medical equipment to the United States to help health workers fight COVID-19. Moscow Medical Corporation was one of the topics discussed by Vladimir Putin and Donald Trump during a long telephone conversation on Monday. The grave situation and the rapid rise of cases in the United States led to the Russian government offering its help. Union workers at a General Electric's aviation plant in the U.S. say the company is failing to keep employees safe from the coronavirus pandemic, adding that the company should refocus its efforts into building ventilators for hospitals.
If GE would clean up and sanitize the factory, we could start manufacturing ventilators that so many hospitals and patients need right now.
Enough's not being done. We want people to leave early and have them clean between every shift, and that's not being accomplished.
Teams of refugees and migrants in the Netherlands are helping out at stores as a token of appreciation for the nation that took them in. Armed with latex gloves, cleaning cloths, and bottles of disinfectant, refugees volunteer in the city of Terrapel wiped down customers' carts outside a supermarket. They expressed their gratitude and hopes to win the heart of villages that host them in the Netherlands' biggest residential reception center for asylum seekers. About 1,900 migrants stay at the center situated on the edge of the village between the Netherlands and Germany.
I'm happy they're doing it. In this way, they help everybody to keep things hygienic, and I think it's good to show. They are often in the news for the wrong reasons, and that's a shame because 95% is doing really well here. And I'm glad they can show that in this way to the rest of the village.
And we end with news in Mexico that due to the quarantine imposed for the coronavirus, all entertainment shows have been cancelled. Although some independent artists have started to stream their performances online, this is not generating any income for them.
The stage in Mexico have closed until further notice.
It is catastrophic, but the worst has not happened yet. I mean, we need to wait to be able to see the dimensions and to quantify the impact of everything that's happening.
And what's happening is affecting the income of thousands of musicians, comedians, storytellers, actors, dancers, producers, and circus artists.
When it's safe, we expect the public to come back to the theater. That help us to go back to work again because we totally depend on ticket sales.
The majority of independent artists live day by day. Their incomes depend on the projects and tours.
Certain biases have been developed in the sector we work in. We are paid 2 or 3 months after the show in the best cases. That means that if everything goes back to normal in May or June, we will only be receiving an income again in September or August at best.
And that's the history of many. The coronavirus quarantine has cancelled every activity that involves any kind of social contact. Cancelled tickets everywhere. The question is how artists and theaters are going to survive in the midst of this health emergency. Since 8 years ago, Cracovia tried to promote social dance. Since a few weeks ago, warned by the European friends, they didn't hesitate to suspend their activities.
We are not being forced to close. We do it because we are being aware that we are at risk of this problem that is happening, and we need to start social distancing.
For the sector, it's hard because the economy is not necessarily functioning well to be able to say, if we close 2 months, we can survive and nothing will happen, right?
This is about an unprecedented crisis, but how it happened is still an enigma. The artists cope with it with creativity and joy.
And with that, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. For our viewers in Africa, remember you can find us on Starsa Channel 461 in South Africa and Channel 539 in Nigeria. And join us on social media. For Telesur English, I'm Doris Polo. Thank you for watching.